This is a Hope 1032 podcast.
Welcome to She Wasn't Born Yesterday, the pod that fearlessly chats about all things affecting us ladies who are 40 plus fabulous.
Well, and the guys that want to know what we think.
Well, them too. I'm Janet Evans, advertising creative.
And I'm Jenny Woodhouse, semi-retired social worker.
In other words, you're busier than ever. We're J&J and we're super thrilled you're with us for She Wasn't Born Yesterday. Gorgeous. I have a friend and she's 40 plus fabulous, which is fantastic. And yet she sees a young male psychologist.
Ooh,
and
okay.
They get on like a house on fire.
Yeah.
And she has recruited and seen a lot of female psychologists, sort of her own age, thinking, you know, that they would be the best sort of match for her. But she has, met Mr. Right, basically. And she reckons you have to swipe left a lot of times before you swipe right on someone who is compatible with you and is right for you as a psychologist. So it seems there's no psychology behind choosing the psychologist who's right for you. Why do you think that is?
Well, it's true, actually. May I just say it's true first, in that there's a whole lot of different counselling approaches, therapeutic approaches, and there's a whole lot of different types of counsellors out there with different types of training, but probably a lot of the work, the positive work done as you're seeing a counsellor or a psychologist is done because of the relationship between the two of you. So you really do need someone that you feel like is at least understanding what you're saying.
Yeah.
That would be step one.
Yep.
And secondly, who can harness the right kind of therapeutic approach that will address the issues you've come to counselling with and also address your way of seeing the issues. Where do you want to head? Do you want to just do some brief short-term therapy for 2 sessions? Do you want to be in psychodynamic therapy for the next 10 years? Where do you want to be?
Wow.
So all of that contributes to good outcomes, but that relationship with the counsellor is extremely important.
But, don't they have sort of set professional guidelines where they're all virtually kind of following the same approaches?
No. No, actually.
Okay.
There's about 10 years ago was the last time I counted, and there were well over 200, something like 230 or 240 different therapeutic approaches documented that are being used by therapists around the place. And then you get the different psychologists who have their different takes on each of those therapeutic approaches. So, it's huge. There is psychodynamic therapy, that the Freudian stuff. Then there's the whole narrative therapy. There's humanistic therapy. There's the cognitive behaviour, the dialectic behaviour therapy, those kind of things. There's solution-focused therapy. There's solution-focused brief therapy. There's interpersonal therapy. There's schema therapy. There's positive psychology. There's motivational interviewing. There's, play therapy, exposure therapy, art therapy. So huge. It's a huge range. That's just the therapeutic approaches. But then you've got, how is this person trained? So we normally talk about, you're going to see a counsellor, you're going to see a psychologist. Oh, well, maybe. Not all psychologists are consulting psychologists. Some of them are researchers. Some of them are a whole range of different things psychologists can do. Then you've got social workers, and there's a huge range of different jobs that social workers can do, one of which is consulting in a counselling session. So you can go and see a social worker as a counsellor. But then you've also got a whole batch of people out there who have gone through and trained in different careers and then changed careers, in their, late 20s, 30s, 40s, sometimes 50s. I had one woman as a student when I was teaching counselling at uni who was 70.
Cool.
So, and they come along and do a degree in counselling.
Yeah.
So there's a whole different range of approaches that people can take from the degree that they've come through as well. And then you've got gender and personalities and, political biases and what agency are you working in? Are you working for yourself? Are you working for care? Are you working for Anglicare? Are you working for big corporations, private practice, whoever? So,
right. Wow. It sounds like the chances of finding anyone who's right for you is infinitesimal. I mean, it's, you know.
No, it's huge. There are so many people doing it.
Man. So who's sort of the best person to steer you at least in the right direction?
Oh, well, if you go to your GP, I normally suggest people go to their GP first. And say, looking for a counsellor, looking for a psychologist. And the GPs have generally got a bit of a handle on who's in the area that they can refer to. And so that's a really good place to start. And if it's a psychologist or a clinical social worker, then you can get a mental health care plan to go and see them so you can get some money back in a rebate, and your GP's the place to go to get that referral for a mental health care plan.
Okay. But they will surely talk to you about what your problem is, won't they?
No, not necessarily.
No, really?
Not if you don't want to tell them.
Wow.
But your GP should know a little bit about you. So
what if they don't? What if you've hidden it really well over the years? Just asking for a friend. And,
well, they might ask a question. Oh, are you interested in seeing a male or a female, psychologist?
Right.
Or I don't know, are you having issues with your kids? Or is this for you? Or are you asking for a friend? Is your friend male or female? And maybe what area you live in. When I refer, I do a lot of referrals to counsellors and psychologists. And when I refer, I often refer people for a half-hour drive away. Well, you got to think in the car on the way there, what am I going to talk about with this psychologist or counsellor? You have your session with them and then you got to drive half an hour back. Well, that's a really good forced time out to actually think through what did we say and how did that ring true for me and what do I do now? And if it's couples,
they can have an argument in the car on the way home?
Totally. Absolutely. Well, on the way there, hopefully, and not on the way home. Yeah, they can make up on the way home.
And but compatibility is sort of it feels like a bit of an X factor. Like you never really know. Like on paper, you might think, oh, well, we would get along really well. But obviously that's not the case, Jen.
And clearly, that's clearly not the case.
I mean, and in my friend's case, this young guy, I mean, who would have picked it?
Who would have picked it indeed?
But so it's just trial.
It's just trial. Right. And so I usually say to people, give them 1 or 2 goes.
Yeah.
And if in the second session, if you're really going, no, I don't think you're catching on to what I'm saying, you're not listening to my language, or you're jumping in too much with solutions. I don't want solutions. I just want someone to listen. Whatever it is. Don't go back.
Yeah.
You're paying. Don't go back.
Yeah, right.
Then find someone else.
Yeah.
Go to the next person on your list. There are lists out there that you can go to and you can look up for names.
Called Google?
Yeah. Well, you can actually look up, the Australian Psychological Association or the Australian Association of Social Workers, or just Google accredited psychologists, clinical social workers, counsellors. Yeah. Most people have a website, so you can check people out on the website. And
I reckon a lot of people would just choose someone by the photo,
Yeah, totally.
What does this
yes,
person look
absolutely.
Like? Does it look like I could have a chat with them?
Yeah.
Or not?
Yeah. Exactly. Yeah.
And do you think there's kind of a bit too many labels these days that, we're trying to slap on ourselves and on each other and on kids? And does that play a part in kind of thinking that you need to go and see a psychologist, or that your child does perhaps?
I think it plays a huge part for some people. Someone suggested, someone suggested I don't do relationships well and that I should see, or someone suggested that my child is ADHD, or someone suggested I better go check it out because I have to always go to a specialist, because you have to pay money to find these things out, and I'm not doing the right by my child if I don't go and pay money to find things out. Yeah, so sometimes that happens. But when you say labels, we label all the time.
Yeah, that's
so
true.
What kind of labels are we talking about?
Like mental health labels, like, I reckon you've got ADHD, you need to go see someone, or you seem really depressed, or, just kind of other people diagnosing people.
Oh, other people diagnosing you. Oh, well, yeah. Well, then you suggest to those other people they might like to go and get diagnosed. But not everyone's going to be diagnosing. Psychologists can diagnose, psychiatrists can diagnose. no one else can actually diagnose. So the diagnosis usually is based on the DSM, so the Diagnostic and Statistical Manual of Mental Disorders. We're up to number 5, put out by the Americans. It's as thick as a Bible, and it's got every mental health diagnosis in it under the sun. That's what they use to diagnose people, they being, psychologists and clinical social workers and others. Having that label, sometimes that label is the most significant thing people have ever heard in their lives. And sometimes people will get a label. Oh, it sounds to me like you've got autism spectrum disorder. Have you ever thought about that? And people just burst into tears sometimes. Such a relief.
Right.
Such a relief.
To finally understand.
Yes. Oh, you mean that I don't have to try and change to be like everyone else?
Right.
This is how I'm made. Yes,
right.
That's how you're made. That label's fantastic.
Yeah.
But then you might get another label, which is, borderline personality disorder. There's a label. That one. Now, that one comes loaded with a lot of emotional reaction.
Yeah.
Because it's seen as a negative.
Yep.
And it's seen as a put down. And if I'm going to label someone as borderline personality disorder, well, you don't want your personality to be the disorder, do you? So that label then gets attacked. Don't ever call anyone borderline personality disorder. And besides, now we have mostly people would be diagnosed instead of that with post-traumatic stress disorder or complex post-traumatic stress disorder. And so I mentioned borderline personality disorder in a talk once, this is last year, and a woman stood up and had a rant at me because how dare I use that label? Don't go around labelling people. And then she said, besides, people, that present with those sort of issues are now called complex post-traumatic stress disorder. Oh, you've just swapped it for that label. I'm sorry, I had the wrong label. But we're talking the same symptomology, right? Yes, we're talking the same. Yes, but we've just got to call it a different label, which is more politically correct.
Okay, so what actually is borderline personality disorder?
You can look up the DSM-4. It's a spectrum, and it's probably best understood in the context of childhood trauma or adolescent trauma, where attachment to important figures in your life has been quite disrupted for some reason or other. So it's difficulty with attachment, and it's difficulty with regulating your emotional responses to things. It often comes with some self-harming or, just risky behaviour. It comes with a whole lot of things. But the problem is that it becomes something that might interfere with your ability to make and keep relationships. So that's why it's come down to the concept of a personality disorder.
Right.
Yeah,
and why that woman related it to trauma.
Oh, yeah. A lot of people that have ever been diagnosed with something like borderline personality disorder have had often childhood abuse in their history. So
wow. So borderline, does that mean you've nearly got it? Or you're sort of borderline, you haven't quite got it?
I don't know whether she's quite...
Why is it called borderline?
Okay. It's called borderline because in the 1950s, late 40s, 50s, when it was started to get recognised as a thing of itself, and the symptoms, the traits, if you like, could be seen across different people as similar traits across different people. So they started to think they couldn't work out, and in those days they used the word psychosis and neurosis. But, those labels, we've changed those labels now to different labels, but they couldn't work out whether it was psychosis or neurosis, so they said, it's actually on the border between the two. Hence borderline.
Hence the word. Wow. And so if you see a psychologist that perhaps isn't right for you, can actual damage be done?
Oh, yes. Yes, absolutely.
Right.
Psychologists, there's a whole code of ethics around how to behave, how not to behave, because a psychologist will have a lot of power. You are paying an expert to get, to tell you how to live life, basically, sometimes. And if you've got expectations of a psychologist that they will fulfil these particular needs for you, and that's what's happening, then it doesn't take much to disrupt that. The psychologist can vanish at any point. They could have a bus accident, they could do whatever. And so if you've come to rely on one particular person in your life and they extract themselves from that relationship, that's very, very painful.
Yes.
So that can be very damaging. Psychologists may, or clinical social workers, counsellors, whoever that you've gone to see, may actually start putting things in your head about what your problems actually are.
Right.
That then these are not your real problems. This is your real problem. Maybe you weaned too early. Perhaps that's your problem. And go down a track that the counsellor themselves might be interested in, but is not actually helpful for you. It's not true to you. There was a big argument in the whole world of psychology. It's still there a little bit, but in the 90s, 1990s, early 2000s, the whole concept of recovered memories, there was a huge outroar. Particularly, people were starting to make complaints against others for abusing them. Going to the police, making complaints. My father abused me, my grandfather abused me. And it's come about because I've just remembered it. I'm in my 30s, I'm in my 40s, and I've just remembered it. That can absolutely happen. I know people that's happened with, and they've confronted their father, and their father's admitted it. I'm aware it can happen. However, more and more it's started to come out as a memory in the counselling session. Well, now you got problems. How much is that counsellor driving that concept of, really, is that what happened with your father? Did your father really do that? So they can do a lot of damage with changing your narrative, in a sense, to something that they are thinking they know more than you do.
Yeah, that's awful, isn't it? Because, I mean, you obviously go there in a very vulnerable state anyway, and you're looking for help.
And you're open to suggestions and advice. A lot of people go saying, I've come to you for advice.
Right. Whereas what do they really mean?
What do they really mean? They mean I want advice. I want you to tell me what to do. The problem is there is no psychologist, counsellor, a clinical social worker in the country that's going to give you advice. If they do, they shouldn't be doing the job.
Oh, really?
Oh, it's not the job of a psychologist or a clinical social worker to give you advice.
So what exactly are they there for?
They are there, well, depends why you've gone. Like there are 100 different reasons. They're there for 100 different...
What if you've suffered a trauma and you want advice on how to, fix it?
Yes, they're not going to give you advice on how to fix it because you're you, right? And you're not the last person I saw who also had a trauma who dealt with it this way. You're you, and you're going to deal with it differently.
Right.
So they will be hearing your story, maybe picking up some threads that are common in your story, maybe helping you think through or readjusting your thoughts about things. Maybe they're picking up maladaptive beliefs that you've grown up with. Maybe they can see ways that you might be relating that we can help you unpack. What does that look like? Like, why are you relating that way? What is it that you're afraid of? What is it that you are desiring? What is it? There's so many different approaches.
Right. But it's not advice they're giving you. It's them teasing out what your situation is.
Or helping you unravel your brain.
Yeah, right. Yeah. Good luck with that.
Not yours in particular, of course.
Actually, it was really interesting because our friend Karen, who was on She Wasn't Born yesterday to talk about eating disorders not long ago, and she was in a 40-year battle with anorexia nervosa, and she'd seen a lot of psychologists over those years, and she said with her current psych, who she'd only been seeing for about a year-ish when she spoke to us, she said she decided that she was the right psychologist for her because of a light bulb moment where the psychologist said to her, right up front, if you don't reach this optimum weight, I can't work with you because actually your brain needs the energy to do the work that we need to do. And because Karen's an intellectual and academic, she just resonated with that direct approach and this woman telling her how it is and before they even did any work together. And it was sort of like, the switch went on that this was, my brain is actually going to be affected and it needs to be right before we can work together.
And motivated her to keep going. Yeah.
Exactly, yeah.
Well, that's a brilliant psychologist right there.
Yeah.
Some people, you're not necessarily going to get a light bulb moment to tell you. And seeing a counsellor or a psychologist. It's hard work. It's really hard work.
For them or you?
Both.
Right.
No, it's hard work for the person coming to see you. So, because it usually is something's wrong, right? You don't generally book in to see a psychologist because you're really happy because you just got engaged. Something is wrong, so it's going to be painful.
Yeah.
So it's hard, painful work.
Do psychologists sort of explain all of that up front and say, look, here's what you've come to me for, but, and it's going to take X number of months, years, weeks to help sort that out, and it's going to be hard work and painful for you. Do psychologists actually talk to you about that?
I would hope so.
Yeah,
but
okay.
You wouldn't be able to estimate how many sessions it'd be. But certainly you would start by hearing someone's story. What has brought you here today? Kind of question.
Okay.
Okay, so what's the story? And then you can get a bit of a handle on the person's willingness to be there, the person's ability to, not to change, but their ability to stick at something that's going to be hard. And you can get a pretty good gauge of that in the first 1 or 2 sessions. In my last job, where I was doing pastoral care work, I was often referring people out to psychologists and counsellors, social workers. And so I would always suggest you start with between 6 and 10 sessions and then see how you go from there. Any mental health care plan will give you 6 sessions, and then I think you'd add another 4 on that as well. That's the average kind of length of sessions that you would go to. And then some people might continue on, or some people might go, I'll have a bit of a break now and, I'll come back to you in a year or so and we'll see how we go. There's different types of therapy as well. So some types of therapy, any psychodynamic kind of therapy, that's it. You go, you're here, you come weekly, we'll talk through this ad infinitum. Sorry, I don't mean to put that down. It's just that you don't really know when an end point will be.
Yeah, right.
So it's kind of in it for the long haul. The whole, I think of Woody Allen going to see his therapist. It's that, lie on the couch.
Yeah.
Yeah. So a schema therapy will be something that, narrative therapy, those kind of, we'll start here, but we don't know where we're going to end up kind of therapeutic approaches.
Yeah, that's interesting.
Can take quite some time.
I sort of imagined that a psychologist would have an end point in mind. But I suppose the other thing too is that if someone comes to you, if you're a psychologist, and they might reveal one thing, but there could be a lot of other things lying underneath that, isn't it? And perhaps it's not until you build that trust that they're kind of open to exposing more and more about themselves.
Happens every time.
That's right. Every time.
Yeah. Tell me about that. Tell me why you hit him in the face. He did this to me. Oh, right, okay. Why do you think he did that to you? Oh, well, is this how? And then, there's that as well. Oh, and there's that as well. Oh, yes. I was, abused as a child. Oh, right, okay, yeah.
Yeah, and, right. Because I guess we're all a bit defensive about what we want to reveal to people.
Well, we are. We're pretty protective.
Yeah.
Plus, you want to put your toe in the water and just see what response you get to the first bit. And if I get a positive response, I might keep going. But the other thing is, I don't think many folks connect the stories as they go deeper and deeper and deeper into their lives. So just talking to someone a little while ago, you and I, who had suffered sexual abuse as a child, and it's years before, like 20, 30, 40 years before someone starts to go down a bit deeper and a bit deeper and a bit deeper, and then can see the connection between what happened 30 years ago and how I'm responding, you're kicking the dog today. It's often just not knowing that there's a connection even there.
Yeah. I mean, as a psychologist or a counsellor, are you sometimes quite shocked by what you uncover in people? Oh.
I've worked with so many folks that I remember I worked in the Anglican Diocese of Sydney in the Professional Standards Unit with victims of child sexual assault. And one of the detectives that was working on one of the cases from the Child Protection and Sex Crime Squad, so he'd been working in this area for years, said to us, these are some of the worst stories I've ever heard.
Wow.
There are so many people that have been so badly hurt.
Yeah. Wow. For them to say something like that, that's pretty hardcore.
Yeah.
I guess with the sort of religious overlay as well.
There's so many overlays.
Yes, yeah.
So many overlays.
Yeah, right.
Yeah. These are in the children's homes, Anglican children's homes.
Right.
These are kids that are vulnerable.
Yes,
kids and,
extremely vulnerable. I mean, there's been a lot about all of that, hasn't there?
The Royal Commission, that was it.
Yeah. And did that involve all of the churches? Like, I know the Catholic Church has been particularly targeted, but all of them.
Yes.
Okay. Yeah, right. Has it actually done anything yet?
Oh,
I know we're off topic.
But I'll catch you up to date later, Janet.
Okay.
You missed that memo.
Yes. So how do we know if we need to see a psychologist?
There's need to see a psychologist or a clinical social worker or a counsellor, or there's a want to see a psychologist. Let's bundle them all together. How do you know if it's going to be helpful for you to seek out the psychological assistance? Well, you might know because you can't get out of bed in the mornings. You might know because your GP suggests it. You might know because your spouse yells at you, you better get yourself fixed. You might know because your kids are saying, Mum, I'm so sick of getting home from school and seeing you sobbing on the lounge. You might know because you can't think straight anymore. You might know because, like I did once a number of years ago, find yourself wearing one black high-heeled court shoe and one flat brown-heeled sandal going to work. So you might know for various reasons, or more likely you'll know because actually something really bad's just happened. I've just witnessed a terrible accident. Somebody in my family's just got divorced, or I've just got divorced, or my kids are driving me nuts. I can't change them. I better change me, or whatever it is.
Yeah, but if you've just got divorced or something, traumatic's happened, wouldn't you expect to feel, just as a normal part of processing things, a bit discombobulated and quite shocked and everything? But does that mean you necessarily need to see a psychologist?
No, not at all. So otherwise we'd have a longer wait to see a psychologist than we do already. But it would if it's just really negatively impacting on your ability to do life. If it's disrupting relationships significantly, if it's going on for a long time, so 2 years down the track and I'm still sobbing every morning, or if friends are actually saying to you, oh, Janet, I'm just a bit concerned about you,
People do say that.
Oh, yeah. I've been meaning to talk to you about it. Probably shouldn't talk to you about it at this point.
Can I get a session with you later?
Yeah, sure. Meet you in the kitchen. Listen to those friends. Often other people can see things sooner than you can. So I've just been working for the last 12, 13 years with CMS, the Church Missionary Society. So I would work with folks that have come back from living overseas for a very long time. Or they'd gone from Australia to go and live overseas, and I would work with them. A lot of what we talked about was the stress of moving country and what stress does to you, and how stress can impact your relationship with your friends, if you're single, or a relationship with a spouse if you're married. And so one of the things I would suggest to them is that I would ask him, tell me, what are the first signs of your wife getting stressed? Or I'd ask her, what are the first signs of your husband getting stressed?
That's a good question.
So that, because your other partner is going to pick it up way sooner than you will. And so listen to those outside voices. If people are encouraging you to do that.
See, the thing is, it would be quite normal for me to wear a black shoe and a brown shoe, any day of the week.
It's out of the norm that we're looking, not out of the norm of the world, because that's like you, but out of the norm of your own behaviour.
Right. Okay.
So if you started wearing 2 flat brown heel sandals, people might get worried.
Yeah, I think so. I would never wear
See,
that.
I would mention that to you.
Thank you. Yeah, I'll stick it to the Converses. Thanks. So is it possible, like, if you start to feel really compatible with your psychologist and start to develop feelings for them, how can you sort of avoid that, or what do you do if that's happening? Because they're possibly the only person who listens to you in your life and
Totally.
really hears you.
Totally, they are, and understand you and empathise with you. Oh my goodness, what a person.
I know.
It's worth the money. Yes. It's a lot of money, but it's worth the money. Yeah. So it's very likely that happens. It's called transference. So I have needs, and I'm going to transfer my needs onto you because you're the person in my life that listens to me and understands. And you're interested. Oh, my goodness, you are so interested in me. I haven't had that before. Ooh, that feels nice. Ooh, poof, endorphins. Oh, nice. I like endorphins. That kind of connection, which again comes back to your first question about can they do damage? So imagine having that kind of influence in someone's life. So that's kind of a likely thing and a normal thing. Don't worry about it. It's okay. Say it out loud. Say it out loud to the psychologist or the counsellor, whoever you're seeing. Say it out loud to somebody. And as soon as you say it out loud, it's just going to sound really silly. And you'll go, don't know why I was thinking that.
Really?
Oh, yeah, probably.
It wouldn't sound silly, do you think? I think it would sound like
it'll sound silly to you.
Scary or sort of.
Yeah, it'll probably sound silly. Oh, what you're doing is if you've got to say it out loud, if you're ruminating, it's just going round and round and round inside your brain.
Sure.
But if you actually say it out loud, you have to access your prefrontal cortex to do that.
Yeah.
Right? And your prefrontal cortex has perspective.
Yep.
Oh, yeah, trust me. Has your perspective, your rational thought, your decision making, your empathy, your emotional regulation. It's all up in your prefrontal cortex, just up behind your forehead. And so you need to access that in order to say it out loud. So immediately you're putting it in a bit of perspective.
Yeah, okay.
Immediately you're putting it into the world of, is this rational or not rational?
Yeah.
Oh, you can see it's rational.
Yeah.
But you can recognise it and say it out loud.
Yeah.
It's very helpful.
Because I'm pretty sure there'd be a code of ethics around all of that, wouldn't there?
Oh, totally.
From the psychologist's
From the psychologist's perspective.
Yeah.
Get a psychologist saying to you, I'm really finding you sexually attractive. Oh, then you run away. Oh, at 100 miles an hour. But that's transference. That's a normal kind of thing that happens in counselling, particularly when you're working with someone who's got a lot of deep emotional needs that are not being met elsewhere.
Yeah, right. Yeah. And can a psychologist suddenly pull the plug on you, like just say, look, I've been treating you for 5 years. I think you're a hopeless case. I'm out. Are they allowed to do that?
Oh, they can. However, they'd possibly find themselves hauled up before a tribunal and be deregistered.
Really? Wow.
So there's codes of ethics. And if you're worried about how your psychologist or social worker or counsellor is behaving or what they're saying, go and check out the code of ethics. Just Google Code of Ethics Psychology Australia. And it's a really interesting read. It's a fantastic read. It'll keep you up at night. So, but in there, it will tell you what they're allowed to do, what they're not allowed to do, but it's all situational as well. So you're really not meant to, for example, barter. You're not meant to barter as a counsellor. Say I'm a clinical social worker. I'm working out in the sticks. I don't know, Cobar. Sorry, Cobar people. There's call you the sticks. But there's no one else around that this poor lady who's just been in a traumatic car accident and all these terrible things have happened in her life. She needs some counselling. There's no one else around. I'm the only counsellor around. She can't pay. Well, I might arrange for her to give me a chicken and I'll do the counselling.
Sounds like a deal.
Because that's the only way she's going to get help.
Yeah.
But that's situational, that's context.
Yeah.
But I'm not going to barter anyone that can pay.
Right.
So it's just, that's unethical. I don't do counselling for you and you come and, clean my house for me.
I can give you a chicken.
No.
How's that?
I don't want a chicken.
Okay.
No. I mean, I'd love a chicken. Sorry, don't get me wrong.
I'll cook it for you.
Oh, okay. Well, now we're talking. You can do that as well as pay me.
Yeah. Oh,
so,
okay.
yeah.
Right.
Go to the Code of Ethics. Find out what qualifications the person has and go to that Code of Ethics and check it out.
Oh, sounds really tricky. Gorgeous. So if someone is looking for a psychologist who's listening to this, what's the best way they should go about it, do you think?
I would suggest the first port of call is the GP. So just to say to your GP, I'm looking for someone, here's the ballpark, issue. You don't need to spill your guts to your GP. but I'd like counselling about this. GPs generally have a handle on who's around, who's in the area, who's good, who's not so good, who they can refer you to, who might even fit for you, who might be a good fit for you. And also a GP is the person to go to if you want to get a mental health care plan,
Right.
which you can do for a psychologist or a clinical social worker, but you cannot do for a counsellor.
Okay. What about a psychiatrist?
Oh, psychiatrists, they're like doctors, right? So,
okay.
they're a different kettle of
kettle.
ball games. Yeah, that's right.
Mental fish.
Yeah.
Yes.
So GP is the first port of call. A mental health care plan, by the way, is where you can get a rebate on how much you've paid. But then if you're not so thrilled, you don't have a GP, whatever, pop it into the Google, as my mother would have said, and check it out.
Dr. Google.
Dr. Google.
Yep.
Counsellors near me. Psychologists near me.
Right, okay.
And they'll have websites.
Have a look at the photos.
Have a look at the photos. See if they've got nice eyes. I don't know. Whatever it is. Do they look like they'll listen to you?
Yeah.
If you go to them a couple of times and you're just not getting the vibe, you're just really not connecting, go somewhere else.
Right. Okay. So ultimately that connection is the thing that you need
Yeah.
to be able to work on something. Yeah, awesome. Fascinating, gorgeous.
There's a big world out there.
Swiping right on a psychologist. Who would have thought?
Who would have thought indeed?
Well, thanks for the, edification and interest.
It's my pleasure.
I'll tell my
indeed.
friend everything you said.
Yes, tell her. Tell Janet. Oh, tell your friend. Yeah, that one. Janet, we love hearing from people, don't we?
Even more than I love you.
So to leave us a message, go to hope1032.com.au, She Wasn't Born Yesterday podcast, and hit us up on the little get in touch box at the bottom of the page.
Doing that right now.
And we'll see you next time.
See ya.
Hope 1032. Thanks for listening.